What ethical considerations guide end-of-life decisions in palliative care? Imagine facing a moment when choices about your health and comfort are at the forefront. How do healthcare providers ensure these decisions honor your wishes and values? That's where ethics play a vital role in palliative care. When patients are nearing the end of life, decisions must be made carefully, respecting their dignity and personal beliefs. These choices are guided by four main principles. First is autonomy, which means patients have the right to decide what treatments they want or refuse, including options to limit interventions that only extend life without improving quality. Next is beneficence, where healthcare providers focus on acting in the patient's best interest, aiming to reduce pain and improve comfort. Then there's non-maleficence, which is about avoiding treatments that could cause unnecessary suffering or harm unless the benefits clearly outweigh the risks. Lastly, justice ensures fair access to care and resources, so every patient receives respectful treatment regardless of their background or circumstances. In practice, these principles translate into actions like advanced care planning. This involves patients discussing and documenting their wishes about end-of-life care before a crisis occurs. It helps guide treatment choices later and prevents confusion. When patients can no longer make decisions, designated family members or surrogates step in to make choices based on what the patient would have wanted. Healthcare teams support surrogates by sharing information about the patient's values and previous wishes. Open and honest communication between patients, families, and providers is essential to align care with personal preferences and reduce anxiety. Legal and ethical rules also come into play. Providers must understand laws about do not resuscitate orders, medical aid in dying where legal, and other regulations to protect patient rights. When disagreements or uncertainties happen, ethics consultations can help resolve conflicts while respecting everyone involved. For someone who has survived cancer, these ethical ideas highlight the importance of having clear conversations about wishes and preparing for future care. Survivors often value quality of life and may prefer comfort-focused treatments over aggressive measures that might not help. They understand how difficult decisions can be for families and appreciate the role of advanced care planning in easing that burden. Overall, ethical end-of-life care balances respecting personal choices with compassionate efforts to reduce suffering. It ensures resources are used fairly and that families are supported during tough times. This approach honors each person's life journey, including the experience of surviving serious illness like cancer, by emphasizing dignity, comfort, and respect in their final days.